Right, so if you have read and understood, considering the surgical anesthesia, kindly tell me what are you looking at?
I'm looking at the cranial fossas, the base of the
Okay.
skull.
How many cranial fossas there are in the base of the
There
skull?
are 3 cranial fossas, the anterior, middle, and posterior cranial fossas.
Can you please tell me the boundary of the middle cranial fossa, please?
Yes, medial cranial fossa, it is bounded anteriorly by the limbus of the sphenoid bone in the middle, and laterally by the anterolaterally by the
That's a wing of
posterior,
sphenoid and anteroclinoid process, and then posteriorly.
and posteriorly by the superior surface of the petrous and the superior surface of the
petrous part of the
petrous
temporal bone and the dorsum celli. Okay, and laterally.
And floor is formed by the greater wing of sphenoid and the petrous, and is common part of the temporal bone.
Okay, can you tell me which one is trigeminal impression for trigeminal ganglion?
44. 44.
44. Okay, good. All right. Right. Can you please tell me what attaches to the styloid?
Yes, the structures attached to the styloid are the styloglossus muscle, stylohyoid, and stylopharyngeus, and the stylohyoid ligament.
Okay. Mostly the skull bones, they present with lytic skull lesions. So what are the causes of these lytic skull lesions?
Yes, the lytic skull lesions, the causes are metastatic
Yes.
lesion,
Yes.
multiple myeloma, Paget's disease, osteomyelitis, hemangioma, sarcoidosis.
Okay, good. Can you please tell me what passes through foramen lacerum? And which one is foramen lacerum?
12. Sorry,
it should be in the
46.
middle. Should be here.
I think it's 10, ma'am. It's not clear.
Yes, it gets enlarged because I have to enlarge it.
Okay. 10.
If it's 10, yes. Please tell me what passes.
Yes, inferiorly it is covered by the fibrocartilage. Superior part it is related to the internal carotid artery.
Yes.
And
which internal carotid artery? Okay. Yes, and
internal carotid artery and deep petrosal, greater petrosal and deep petrosal nerve before they enter the pterygoid canal.
Very good. Okay. What about what passes through foramen ovale?
Yes, the structures passing the foramen ovale are the otic ganglion, mandibular division of trigeminal nerve, accessory meningeal artery, lesser superficial petrosal nerve, and the emissary veins from the pterygoid plexus to the cavernous sinus.
Okay, this 6 and 8, this is what, if you can tell me?
6 is the cristagalli, and 5 is the cribriform plate of the ethmoid bone.
Okay, what passes through it?
The olfactory nerves.
All right, okay. Can you also please tell me what bones form the posterior cranial fossa?
The posterior cranial fossa is the bones forming posterior cranial fossa are the petrous part of temporal bone, the occipital bone, and the parietal bone.
Yes. Okay. Can you tell me which venous sinus tracts are present in the posterior cranial fossa?
Yes, we have the transverse sinus, the occipital sinus, and the straight sinus forming the confluence at the internal occipital protuberance. Then the transverse sinus, it drains into the sigmoid sinus, and then finally into the internal jugular vein.
Okay. Can you?
And
yes.
we have the
yes, please.
superior petrosal, inferior petrosal sinus.
Yes. Can you please tell me what is pterion?
Yes, pterion, it is a H-shaped point that is formed by 4 bones, union
Yes.
of 4 bones: the frontal, the parietal, the squamous part of temporal, and the greater wing of the sphenoid bone.
What is clinical significance of pterion?
Yes, it has internal relation to the middle meningeal artery, and trauma to that area can cause laceration of the middle meningeal artery, causing extradural hemorrhage.
Okay, can you please tell me, you told me all the, okay. Can you tell me what is straight sinus? Did you tell already?
Yes, straight sinus. It is formed by the union of the great vein of Galen and the inferior sagittal sinus. Sorry. Yes.
Okay. Can you please tell me what passes through 11 here? Sorry. 11.
11. This is the foramen magnum. The structures
Yes.
passing through the foramen magnum are the inferior part of the medulla oblongata and the spinal root of the accessory nerve. And then we have the vertebral artery ascending, then the anterior and posterior spinal artery. We have the tegmen tympani and the apical ligament of the dens.
Okay, what is clevis? Am I saying it right?
Yes, clevis is the downward sloping part of the anterior portion of the occipital
Can you
bone.
identify here first, please? Which
Number 4,
is?
ma'am.
Yes, very good. Yes, what is it? What's the significance of it?
Yes, clevis, it is the anterior relation of the brain stem.
Yes.
And we also have the abducens nerve traversing through that, and also it has the it has the spinoccipital synchondrosis. It is formed.
Okay, can you name the structures which pass through jugular foramen?
Yes, jugular foramen. The structures are the glossopharyngeal, vagus, and accessory nerve. The sigmoid sinus and the internal jugular vein.
Yes, good. Okay, what is stylomastoid foramen? Which one is it?
Yes, stylomastoid foramen. It is the foramen that lies in the inferior aspect of the base of the skull, which through which the facial nerve and the stylomastoid artery
passes. Very
passes.
Good. This facial nerve, it supplies. Can you please tell me the intracranial course of facial nerve?
Yes, facial nerve, it originates from the pontomedullary junction, and then it traverses into the internal acoustic meatus, then in the facial canal in the petrous part of the temporal bone, and then it exits the base of the skull from the stylomastoid foramen to give 5 branches: the temporal zygomatic, buccal, marginal mandibular, and the cervical branch.
To the face.
Yes, ma'am.
Yes, good, good. Right, very good. I evaluated and you have prepared it very well.